Hi, we're group 2 and we're going to be covering cases 5, 6, 7, and 8. So I'm going to be talking about case 5, which is selecting an EHR for a dermatology practice. So this is an 8-physician dermatology practice, and I am the practice administrator who has been tasked with leading the team charged with the selection of an integrated practice management system and EHR. Dan Brown is the current CEO, and he's not really keen on a electronic health record because of the negative opinions of his colleagues, but with value-based payment and improvement of quality of patient care, he's looking into getting an electronic health record. New partner Pam Martin, she just completed her residency, and electronic health records were a big part of her training, so she is offered to lead the efforts of selection and implementation. John Harris is another partner who went to a conference and is very impressed with all scripts. And the current state of our office is we have a computerized practice management system for patient scheduling and billing, and there's been some prep work done to prepare for an electronic health record. The practice currently has approximately 4,000 patient visits per month, including 40% Medicare and 10% Medicaid. So convening a practice management EHR selection team, there are 4 essential members of the team, which are the executive sponsor, business sponsor, project manager, and IT manager. Dan Brown, the current CEO, would be the executive sponsor. I, as the practice administrator, would be the business owner. Pam Martin would be the project manager, and a senior IT personnel would be the IT manager. And the reason I chose these people is Dan Brown, as a CEO, would be in charge of acquiring funding and promoting the project. I, as a practice administrator, would help manage the day-to-day tasks, and Pam Martin would use her expertise to run the project. The EHR readiness assessment, I would gather the team and evaluate the following factors, and each readiness area would be scored 1 to 10. Any area that averages below a 5 would be allocated additional resources to ensure success. And the 4 sections of readiness assessment are organizational alignment, management capacity, operational capacity, and technical capacity. The draft system selection plan includes screening the marketplace and reviewing vendor profiles, determining and prioritizing system requirements and goals, exploring other options to acquire a system, which includes leasing and in-house, evaluating vendor proposals, which would involve having the vendors demonstrate their products, cost-benefit analysis, and preparing a summary report and recommendations. After you complete all of those steps, you would move forward with your contract negotiations. I envision the biggest problem would be agreeing on a system, considering there are 8 different partners at the practice, all having different opinions, and cost will ultimately be the deciding factor.
Hi, I'm Colin Vanmeter, and I'll be giving an overview of Case 6, titled Watson's Ambulatory EHR Transition. The Watson Community Association is a for-profit organization that has a 200-bed hospital and 8 clinics that have been incorporated into the organization. Now, the clinics in the hospital used different systems that were compatible, but the clinic system was forced to adapt because the functionality in the current system has been limited, leaving clinical physicians' needs as a secondary issue. The primary goal for the new system is for physicians to be able to have a better resource to use, whether this is done by upgrading the current system or replacing the system with a new EHR vendor. The EHR project has been divided into a systematic approach to make sure that the clinics are going to install the best EHR system for them and not just what is compatible with the hospital. Now, in the plan development phase, they will have a project steering committee created, which will have representatives from all stakeholder groups such as IT, finance, clinical physicians, and office managers from both the clinics and the hospital. When that is complete and the committee has convened and expressed all their concerns with the older system, They will then create objectives that meet the needs of the organization and not just certain individuals or groups. This allows them to have a system where they can maximize their time and find vendors that will suit all of the clinic's needs and also be able to connect well with the hospital. Now, the leadership of the selection committee need to take many factors into consideration when deciding on whether to stay with the current vendor and just upgrade or to take the time to find a new one. The integration of the platform will be important because the staff of the organization need to be able to utilize all the features that make the EHR system worthwhile without having to adapt their system in order to connect. The committee needs to make sure it is easy to install the new system and that it will take time and effort by the staff to learn the system. The amount the system will cost not only to implement initially, but in the long-term maintenance will be a consideration to know whether the organization can even afford the system that they're looking into. The clinics need to have the ability to reach out to the EHR system vendor if there are any issues, technical issues, or any sort of system issues that may come along with it that cannot be easily resolved by their own IT. And then the final consideration is that the new ICD-10 codes that healthcare organizations need to be up to date and accurate so providers can document the correct diagnoses for their patients. Now I'd like to turn the discussion over to Daniel, who will go over the strengths of the plan and potential improvements.
How's it going? My name is Danny, and we're going to talk about the strengths of the transition plan. Sorry about the background noise. I'm in New York for a work trip, so this is the best I can do. So we're going to talk about the strengths. The project steering committee has 25 to 20 members, and we did this to ensure success. So this way we can have multiple people from different backgrounds bouncing off ideas off at each other so we can make sure we get the best results. Having a bigger pool of people, it will ensure that only the best of the best results come out of this project, and they will be the most successful ones at that. So we're talking about the aspects that are important. So the outline consists of contingency plans for any situation that may arise. We hope to expect for the best and prepare for the worst. This is important as anything could happen at any moment, and as you want to be prepared. For example, New York and the entire United States was not prepared for the whole COVID-19 epidemic, and as this has caused a huge problem that will linger in the country for a long time. This could have been prevented if the United States had a protocol for any epidemic, and I'm sure it is clear that next time this happens, we will be taken care of. The communication protocol emphasizes allowing frequent updates so clinical users and stakeholders can get feedback and receive information about progress. This is very important as being a shareholder in a company like this will make the shareholder feel very in the loop and confident if everything is going well. This will build consumer confidence, which could lead to more shareholders joining the company, and the key to any successful relationship is honesty, and the same principle applies within a business. So let's talk about things I were to change if I was in charge. So another route would be to have the Watson Community Association, or the WCA, outsource vendors and searching for a company that has vast knowledge in the system requirements and matching vendors. This will make sure that the company has specializes in that system rather than us hiring people and then training those people on it, and which can be a long process and very expensive one at that. And as a new HR system is costly and needs to be improved, I believe that the CEO or CFO should be more involved during the searching process to make sure that he likes what he is getting and he makes the best decision. While the committee is diverse through the WCA to ensure stakeholder representation, the amount of resources and staff committed to the search is large, where the staff could be used on other projects. This could have the organization push these people to different departments, which could further push the boundaries and utilize those people to work on new things, which is a good thing. And then having IT do research before the committee representatives attend the vendor conference will aid in the representation at the trade show instead of the simultaneously or after. This is critical as having a clean conference presentation makes you seem more professional, which will attract and make more people want to work with you. Thank you.
Hi everyone, my name is Ananias and I'm going to be presenting to you on Case 7, Concerns and Workarounds with the Clinical Documentation System. In this case, we are presented with a children's hospital that is implementing an electronic documentation system change. The hospital is owned by an academic medical center, Premier Health, that includes an adults hospital, a psychiatric hospital, and a full spectrum of adult and pediatric outpatient clinics. Premier Health has already implemented the new electronic documentation system in its adult hospital, and the same system is now being implemented at Garrison. As we read through the case, we see the issues that the employees at Garrison face during this implementation phase, and we see how the employees get frustrated and feel unprepared for this change. Working through it, we will find the best way to address the issues. The major problem in this case is that Premier Health has implemented a clinical documentation system that none of the staff members or clinician at Garrison's Children's Hospital feel adequately trained on. The factors that contribute to this situation are that Premier Health proceeded with implementation of this system too fast. This means that the staff and clinicians at Garrison's Children's Hospital did not feel adequately trained on the system. This caused the staff to be dissatisfied in the process of implementing the system. Additionally, not much consideration was given with the differences between the adult and the pediatrics settings at Premier Health when implementing this new system. This created more complication in workflow processes. The staff did not feel adequately trained, so they began to make their own workarounds. I agree with the nurses for their argument because whenever a new clinical documentation system is implemented, it is important to remember that different departments have their own specific needs and their own specific strengths and weaknesses. When comparing the pediatric unit to adult hospitals, we can see that there are a variety of differences. In this case, the organization failed to properly execute the IT plan well. According to Chapter 7 in the textbook, this factor hinders value return on the documentation system. Additionally, Chapter 6 discussed the system implementation process, and one of the things that must be included in the process is that sufficient staff time and resources must be devoted to the project. In this case, it seems that the project was rushed and there was a lack of staff that were on board for the change. Premier Health should have spent more time analyzing the process for the old clinical documentation system during the pre-implementation stage of this project. This way, they could have gathered more data for each different specialty and their workflow within the health system. Additionally, Premier Health should have slowly implemented the system by trying for a few months at a time between the pediatric medical units, surgery units, and ICUs. In this case, it says that Premier Health first implemented the system in the adult hospital, and after 6 months, the system was implemented in the other units. This would help them better troubleshoot issues from the system in the way that is specific to the unit. To better resolve the issue at hand, I would first go to each department that had to use or interact with the new documentation system at Garrison and speak with their staff members to find out what exactly the issues were. I would ask what was causing the increased workload and what they think is unsafe about the system. While doing this, I would make a list of responses that are given to me. Next, I would get together with the system support team to address these issues so that they can properly train the staff at Garrison on the new system. I think that these steps would be necessary because we are at a point where it would be too costly and time-consuming to turn back from the implementation, so we have to move forward. Additionally, since each department deals with a different workload, I would like to hear specifically what the Garrison members are dealing with to better address the issues. Once I get the necessary information, I feel that I would need to staff the issues with the system support team so that they can look at creating new flows that better train the Garrison staff. What I learned from this case was that when implementing a new system in an organization with several different branches and specialties, be sure to gather sufficient data of the current workflows on each department before implementation can begin. Also, I learned how important it is to take time when implementing a change in clinical documentation systems. This will help the staff feel more comfortable with the change, and this in turn can help make the implementation process smoother.
My name is Tajay Desnor.
And I'm Kayla Williams, and we had Case 8 conversion to an EHR messaging system. So the Goodwill Healthcare Clinic services are offered across 11 primary and specialty care units. Each unit operates separately, but they share a common medical record numbering system that allows unification of all documentation linked to a patient regardless of what unit they are seen in. The clinic uses a call center that receives calls from patients who need to schedule appointments, request medication refills, or speak to someone in one of the units. Currently, the center uses a customized Lotus Notes system where messages are closed once the proper action has been taken and notes created from closed messages are printed and filed in the patient's records. These notes can't be accessed via the EHR.
With that being said, the Goodwill Healthcare Clinic requires that all medication lists and refill information to be up to date in the EHR. This means that the information documented in the note system must also be in the EHR. In other words, what the call center is using in the Lotus system should be compatible and be used in the EHR system for transparency for all departments. Not all units all the available features of the EHR. Some units have been receiving physician resistance when it comes to adding more EHR functions, which we'll speak on and how to resolve that issue. The goal for this clinic is to implement the messaging feature, the Lotus system, and prescription writing component of their current EHR in the call center. And the clinical units while improving the quality of the documentation of calls and prescription refills. The long-term goal is to also add a patient portal feature. So the point of this is to implement a strategy to have the Lotus system to be combined with the EHR system and to also provide a patient portal for transparency of clinical care altogether.
Okay, so the first question was asking us what steps would we take to make sure that the conversion from the existing call center to the new EHR system is smooth and successful. The first step that we would take is to understand the goal of the new system. Why do we need this system? The next step would be to understand the current status of the system. So what is wrong with the system now that we need to convert to an EHR system? The third step would be understanding the functions of the new system. So basically learning how to operate the system. Then we would train our staff to make sure that they are confident with their skills on how to operate the new system. Once the system goes live, we will monitor the performance of the staff and ensure that compliance of the new system.
Exactly. Feeding off of what Kate said, we developed a strategy for it. It's called define, measure, analyze, improve, control. We define the problem. We implement the project to measure the improvements analytics-wise. We then analyze the improvements to see what we could be done. We improve the system and then we control the system to ensure compliance and maintain good quality of care using the EHR system. Now, people involved in the conversion planning and implementation. Now, when we have the project implementation, we'll have to include the staff, which includes the nurses, physicians, and receptionists. The staff should be included in the process because they'll be the one using the system, so it's essential they know how to use the system and to avoid medical errors. Having them involved will make the transition smoother when it comes to training. They can also discuss errors and challenges they face within the system and bring it to IT's attention. Like I said previously, we're going to measure the results, analyze, and this is when we could improve. That's why the staff is essential. We're going to have the project manager, the one that oversees the whole project, see the duration, how long it's going to take, the cost and everything. And the project manager will focus on developing and maintaining timelines and tracking the project of the system, as I just said. IT will resolve the key issues and the roadblocks, as they the ones will be the ones implementing the system, like using the computer science aspect behind it and everything of that matter. And we're definitely going to have the shareholders. The shareholders will approve the implementation. That's the stakeholders. They're the ones that have like the percentage of company ownership, so it's essential they know what's going on since it's their money. And patients. Patients will help us improve and control the system. This is essential for the patient portal. We're going to see what issues they have, how we could improve those issues, and so on and so forth.
Alright, so the next question was asking us what strategies would we use to basically prevent physicians and other users from resisting to the conversion. So first we would understand why they are resisting. We would identify their concerns and fears that the staff may have regarding the new system. Next, we would effectively communicate to the staff basically how important it is to move over to this system. Explain how beneficial it is to the organization. We would also make sure that everyone is trained properly. So with our staff being trained properly, they will have a positive attitude about the new system and they will feel confident on how to utilize and operate it.
Now, is making sure all units are running to the same EHR system a necessary precursor to the conversion of the message and prescription writing components. Basically speaking, it's all the information before, like when the call center was using the Lotus system. Do we need all that information before we do the implementation of the EHR system? Absolutely, because if we do not include the information that's in the Lotus system from the call center before, we're going to have a lot of lost patient information. And if the new EHR system don't have all that information, then there's going to be lack of quality of care for patients because we don't have all the patient's information, especially if the patient been with the clinic for like 20 plus years and they were using the Lotus system for like the past 15 years and we're just now implementing the new system. That's a lot of patient information we're missing. So it's absolutely necessary that we have all units. So as I just said, before the information documented in the note system had to also be in the EHR system. And because there is no function to add these notes in the system, they were printed and followed in patient records. Having all units run to the same EHR functions will prevent errors such as patient notes being followed in the wrong record and patients' files being missing.
Okay, so the next question was, how might the implementation of patient portal feature address some of the current issues? So the whole purpose of the patient portal feature is where patients can send messages to have their refills electronically filled, schedule appointments, or speak with someone regarding their needs. It'll make it easier for the staff to make sure that the patient needs are being met and that their calls are being handled accordingly. What workflow considerations will need to be made? So once the patient refills his or her prescriptions electronically, who will document it? Will the system automatically notate that the prescription was filled, or will it be the staff member's duty? Once an appointment is made, will the system automatically update availability, or is it the receptionist's job to track the availability?
And that is it.
Oh, you don't want to add to it?